lot of our research is aimed at treating cancer on an individual basis and treating patients individually for their own specific cancer. In that way, our research will enable us to really make cancer a chronic disease in the future. So our new research is focusing on women who've developed a second breast cancer 6 months or more after being diagnosed and treated for their first breast cancer in the opposite breast. And really what we want to understand about these women is what are the risk factors for getting a second breast cancer and how many of those second breast cancers may have been related to their first breast cancer. And the reason for looking at all of this is in terms of we're focusing on personalizing the treatment for these women. So realistically, if a woman has developed a second breast cancer that's related to their first breast cancer, that will impact how we decide to treat that woman. And additionally, and more importantly perhaps, if we can identify those women at an increased risk of getting a second breast cancer, we can offer them a double mastectomy at the time of their first breast cancer. And perhaps equally or more importantly, for those women who aren't at risk of getting a second breast cancer, we can advise them they don't need to have a double mastectomy, which is an operation which is being increasingly used for the treatment of one side of breast cancer, despite the fact that it doubles the complications from the treatment. By raising money for Cancer Focus Northern Ireland, you're supporting world-class research here at Queen's University, which will benefit breast cancer patients and other cancer patients all over the world, but particularly benefit those here locally in Northern Ireland.